Hi, everybody. This is Dr. Ehsan Sadri. I'm a board-certified ophthalmologist here in Newport Beach, California. Been practicing for the last 16 years and just absolutely delighted to be here with you. Today's topic is going to be some of the questions around cataract surgery, vision surgery in general. Number one question I always get asked is, does it hurt? And how do I keep my eye open? And it's a really good question, and I think it's something that's a very valid concern. Anytime anyone's going to work on your eyeball, you're going to be scared. Me as a patient, I'll be scared as well. I'm a terrible patient, by the way. So what do we do? How do we do that? Does it hurt? The number one thing is to thank God for modern innovative technologies. The eyeball surgeries that we do does not hurt. And the reason is because of one word, anesthesia. So I always joke around with my friends in the OR and say, the difference between a great surgeon and an okay surgeon is a great anesthesiologist. And the reason for that is because when you go in there, we give you something that's going to calm your nerves down. That's basically called anxiolytic. Usually something like Versed or fentanyl. Same thing, you get what we call twilight. So you kind of hear stuff, but you're really not aware and cognizant of what's happening. So it's very comfortable. The other thing is now modern cataract surgery is topical. So there's no needles, there's no shots, and 99.99% there's no stitches involved anymore, which is great. And with the advent of the laser therapy, the recovery and what we call ease of the actual treatment itself is remarkably quick. So most of my patients drive the next day to their clinic here and they're happy. Are they 100% the next day? No, but it takes the time. I always tell patients 80-20, so 80% of the vision comes back by 1 month, the remaining 20%, 6 months. And the reason is because of the brain and the eyes have to get to know each other. What's remarkable about the technology is we always ask, is there pain? No. The patient describes no pain, but they say there's something like in their eye. They might feel like a scratchiness or a piece of sand or something. That's within normal. The other thing I get asked is, so what's the common side effect or typical recovery thing? There's about 3 things that we always tell patients. Number one is, if you're getting the advanced lenses from me, where that basically gets rid of your reading glasses and your driving glasses, you might see some fuzz around lights at nighttime. That's number one. Number two, you might notice a little shadow on the side of your eyes when you're driving. You might notice there's something here when you're driving. And number three, you might notice little floaters, or what we call little things flying around. And you might have that already, but it's more pronounced immediately after surgery. All this stuff will go away with time as your brain adjusts. It's remarkable. I have patients 20 years out, they come and see me, they're still not wearing glasses. It's pretty remarkable. Those are the main things that we always talk about, pain and recovery. The other thing is, who's a good candidate? Like, what if I'm 40 years old, 30 years old? Do I do cataract surgery? Do I do lens surgery? How do I know? Well, obviously the number one thing to do is ask your professional eye doctor, get a full eye examination. But in general, in the United States, if you're north of 50 years old, in my hands, we don't do laser surgery anymore. There's some surgeons out there that will do it. And that is not to say everyone's a bad candidate, but in general, you'll hear in parties, my LASIK wore off. And the reason your LASIK wore off is because maybe the patient was a little bit too old for the laser procedure in general, and the actual problem was the lens and not the cornea. The LASIK surgery, we operate on the cornea. So who's a good candidate for LASIK surgery? Well, the patient who's like 20, 25 years old, they're myopic, what we call nearsighted. So they can actually see near better than far. These people wear contact lenses or glasses just to drive. Great laser candidates. Why? They're young. Their return on investments of time, energy, and resources is going to be at least 20 years, which is great. That's what we want. The last thing you want to do as a surgeon is to operate on somebody and then a year, 2 years, 3 years later, they need glasses again. That is not how I run my shop. And I don't recommend anybody getting treatment. And ask your surgeon, hey, how long is this going to last? And the biggest wonderful thing about modern cataract surgery, which is now we're starting to do them in the office, is that fast of a recovery and permanent vision correction. There's something to be said about that. Having said that, you still have to check with your doctor, make sure there's plenty of experience there, you feel comfortable. When in doubt, don't. That's kind of been always my motto. It's like, when in doubt, take a pause, think about it. There's no emergency. I always tell patients, I have patients that come in, they're maybe biologically ready, but they're not psychologically ready. So when they come in, their eyes are ready to go. They're still able to see, but not really great, and they probably shouldn't drive that much anymore. But they're pushing it. And if they're not ready, I'm not ready. I tell them, look, whenever you're ready, just come on back. And sure enough, they come back. Because as you all know, our bodies change. What I call father time is undefeated. So it's a pleasure to be here with you, as always. Don't forget to press the subscribe and like button. We're always here for you. If you have any questions, put it in the comment section, and we'll personally get to you. Thank you so much, and have a wonderful day.